global health, there are not many healthcare professionals that are working. A lot of people, they have other background like international relationship, management, leadership, but actually nurses have this understanding about health, and they will help you like really to deliver impactful and effective project or programs because you have this perspective.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today's guest is living proof that nursing skills know no borders. We're joined by Mara Ferrari, a nurse and global health professional with over 10 years of experience leading initiatives across Africa, Asia, and Europe. Mara has dedicated her career to advancing health equity around the world. Through roles in global program management, impact evaluation, and policy development, she's applied her clinical expertise to help shape healthcare systems from the ground up. It all started with a desire to travel, a nursing degree, and a deep belief that she could make things better. In this conversation, we'll explore Mara's nursing career in global health, her real-world experiences working in countries like Uganda and Laos, and how nurses can be powerful voices in shaping healthcare solutions around the world.
Oh, thank you, Audrey, very much.
Yeah, I'm so excited to get chatting today. Why don't we just start at the beginning? What originally drew you to the nursing profession?
Thank you very much for your question. So I started to be very passionate about nursing, when I started actually to study it. Initially, when I was in high school, I also had an interest through medical professional to understand how our body works, the human parts of the body. In fact, initially, I was just basically exploring different healthcare professionals. I was exploring to be a midwife or physiotherapist. At some point, I wanted to be a dentist, for instance. But then eventually, I turned up to study nursing. I absolutely loved it. I loved the part how would you understand how your body functions, but the best part was actually how to look after people and take care of people, and especially the people that need the most.
Mm-hmm. Yeah, if you're interested in just health and the human body, nursing is a great place to land because it is so broad. You can kind of go into whatever, specialty you want to versus something like PT or dental. You're a little bit more focused on a specific system.
No, absolutely. You're right. I think this is one of the strengths to be a nurse. We really have to know everything, all the human body, all the human system. So that will really give me the chance actually to pursue the interest that I had.
Yeah, definitely. And you were born and raised in Italy. What was healthcare culture like there, and how did that play into shaping your early experience or perception of nursing?
As I was saying before, yes, I came from a small village in the north of Italy, and I studied there, my nursing bachelor. And to be honest, the study that I did, it was actually very good. I loved it. They really emphasized the nurse and empower in charge of the care of the patients and not only of the cure as the doctor. However, when I faced the reality of the profession, when I was in my first placement, I could see that the role of nurses wasn't actually valued as it was supposed to be. I had even patients that were asking me, for instance, do you need a degree to wash your body? Do you need a degree to draw a blood sample? And so on. So what happened to me, basically, during one of the lectures, someone came and he was explaining about the different healthcare system. and it was explaining about the UK healthcare system. It was explaining where about nurses are more empowered in that role, is a profession that is very much considerate and the social level. And also like they're very much in charge about, all the management of the hospital and the setting. These things in Italy wasn't really present. I'm talking about, 15 years ago. So I used to be in Italy every year. Now these things and this value the nurse is given now. And we overcome this struggle. So anyway, after listening to that, when I finished my nurse degree, I, take my luggage. I went to UK, then lived to London. I started work as a nurse there. And actually have a very positive experience to work in the NHS systems.
Amazing. And is that kind of when you started to feel the pull towards something beyond the traditional like bedside clinical nursing, or did that happen later for you?
For me, these things happen later. Initially, I just really have a desire inside, like to explore, travel, see the world, very naive in my 20s. And then after I got like 2-3 years of experiences, I started to ask myself, okay, this is a big world. What is out there? There must be other things, behind, UK, our traditional healthcare system. So I wanted to understand a bit more like a human experience. In fact, 10 years ago, I even applied to go and work in conflict zone, for instance, in Afghanistan. I never got it. I never went. But at the end, through that, it didn't matter for me. I pushed because I really wanted to, explore, see. And it was more really a curiosity that I had initially, more than actually linked to a career, professional career. So I persist, and I saw that I need perhaps more qualification or course in order to be able to work at a more international level or cooperational level. So I went to Liverpool. I studied diploma in tropical nursing, and for that point that I started to have a bit more broad perspective of what is about health and global health at large. So through that study, I managed to go to a couple of missions, volunteering as a nurse coordinator and capacity building. And through that exposure to international health, something started to change inside me. I say, okay, these are different sectors, different environment. So from that moment, more later, I started to say, okay, this shift about be pulled to something else.
Yeah, that's incredible that your desire to explore and travel kind of fueled where your career went. When I was I guess kind of midway into my nursing career, I became a travel nurse because I had a similar desire to just explore. I didn't want to be in one place. I wanted to, explore different places. And, that's different. Just travel nursing across the US, is much different than getting to experience healthcare in different countries. So it's really cool that you were able to get that global perspective. Was there a defining moment within all of that, or a moment or experience when you kind of realized that you wanted to work in global health and make that your career?
As I say, before, for me, it was more actually the one defining moment. I mean, I have one defining moment that I'm going to tell you, but it was more literally a process. It was a learning curve. I didn't know back then, any nurses that they were in global health or any other healthcare professional working in the sectors. So I really, tried to push with this desire. I keep going until I got that moment that it was in Laos, where I went to volunteer as a nurse coordinator. It was in northern Laos for a children's hospital. And you really see there the dire and the struggle that I have in terms of healthcare. And I started really to understand that my skills and my professionalism, it could be applied to other settings that are common, to hospital setting, let's say in an income country like UK, it could be US or Spain or so on. So from that moment on, when I start to see how I could contribute to the learning, the development, for instance, of the local nurses in lower resources settings, for that moment, I say, okay, there is much more behind that of my clinical skills that I can use and contribute to improve the society, but could actually implement these systems that actually allowed us to deliver care or any other profession to deliver care.
Mm-hmm. And I think that, something that you said that really stuck out to me is like you didn't see a lot of nurses in global health. And so I think it's really impressive that you followed your passion and you saw these problems and you're like, hey, my clinical background, my clinical knowledge, like prepares me to be in a position to help like fix some of this stuff. So I think that that's just really cool. And I think we're seeing like more and more nurses involved in global health. And I think that that's amazing. And for like some of our listeners who might not totally be familiar with what global health is and what that really means, how would you define global health? And like, how does a nurse really fit into that setting?
So, well, if you go Google it, you will find tons of definition about what is global health. But for me, like global health is us, is all around us, is our body, is our mind, is our community. It's really like about not only the lack of diseases, but is the opportunity to fulfill like a healthy lives. That is crucial. Like it's a wiser person than me, the director of the WHO, he say actually that like global health and especially equity linked to that is the food we're sharing, is the water we're eating, is the air we're breathing, is the doctor, nurses, healthcare providers that actually saving lives, but it's also other like could be our neighbor that look after us. And I think one of the example, if you think about COVID-19, which is actually an example that this is really make you understand what is global health is the fact only it's not only the individual care that you could give to a patient, but it's really more about a collective well-being, about the health of all the population, of all humanity, and not only refers to humans, but also to animals health and also our planet health, our environment, and all these things, they influence and shape our understanding and our health, and also the decision that we are taking regarding it.
Mm-hmm. I love that definition. I mean, it's a very broad thing, but I love your kind of holistic perspective. So yeah, I think that's an awesome definition. And you mentioned like several different countries that you visited that you spent time in. What did you learn from those experiences about gaps in access, health equity, and like the role that culture can play in health outcomes?
I learned many things because that were actually the experience that they give the fundamental of what is my, value and mission in this profession. And definitely that the first lesson that, all around the world, there is not enough resources. We comes like from country where actually we could complain there is a gap in access and so on, like in our healthcare system. But over there in other sector, really, there is there is no staff, there is no medication, there is no ability to access to care. But I think the most important lesson that I learned is about the concept of health. When we think about health, I think we're thinking about hospitals, nurses, doctors, diagnosis, and etc. But what I learned from an experience that I have, for instance, in Laos, I actually learned these things through a sad story, which was the death of a 4-year-old boy due to a chest infection. He came to the hospital at 2 a.m. I was there coordinating with the other local nurses. And after 20 minutes, he went into a crash in cardiac arrest. And eventually, after 4 hours, we tried to reanimate the child. He passed. So this is a sad story. But then it started to make me reflect on what does it mean health, and if it could we done more? Like how is possible in 2018, like a child die from a common chest infection. If you think about, our children, it's unlikely they would die like for a common, pneumonia in our sector. But over there, no, was actually, not every day, but was quite often. So I started to pose to myself this question and investigated a bit what it was behind. And so if you listen to the story that this family, they brought this child like already, at a very late stage of sepsis, you understand many things. The first one, well, seeing the context as well, like Laos is a very mountainous country with 65% of mountainous with no paved road, lack of transportation in a lot of village or rural area. So this family was actually 2 days walking from the first point of care, the first hospital, specifically for children hospital. Then you understand also that they come from a community in the rural Laos where they believe they're animists. So they believe in spirits and nature. So they have this kind of religion culture. So the first things the family did, the mother, the father, this child, was to bring the child to the shaman. Okay. And the other 2-3 days passes. Then eventually the mother, they live through agriculture, basically. So they cannot really leave the place, and then be able to provide for their family if they actually don't work. And this is another side. This is a work condition that someone could have in order to be able, to access to care. And then there was the transportation, as I mentioned, they didn't have a car. There was no public transport. There was in a very rural area. So they have to take couple of days of hitchhiking in order to reach the hospital. It only eventually, because the mother heard from another mother in the village, there was a Western hospital, very close, where the child could be treated. Mm. So can you see all the pattern? Can you see the health? It wasn't only the access to the hospital, but a lot of other things that could be done before, and a lot of other things are in place in order to be healthy and be able, to...
Yeah. And so let me ask you this, because I hear that story and it's just one thing after another that prevented this child from getting the care that they needed and when they needed it. There's just so many things, and they're pretty complex things. They're not super easy things to solve. So when you're working in global health and you're looking at problems like this, how do you even begin? Where do you start? How do you start to solve these really complex issues?
So as a start, the first, at this time in my story, the understanding and the investigation, it came to the end when the accident happened. So the first things that you must do is to listen, is to understand what is your context and where you're working. I mean, if I try to implement a program I'll say Myanmar or in India or something like that, and I have an idea, okay, but I'm sitting in Spain right now, and I have all this, background about my healthcare system, how does it work here? Do you think will we work over there? I already say to you is a no. You will not work there. So you definitely understand and listen and try to understand what are the health challenges of the country or the community as well, because it could even be very different, even in the same country, but rural community versus an urban community, for instance. It's not only that, it could even change through the gender you were born. If you're a male or female, it changes quite a lot. So the first thing is definitely understanding your context, talk to people, understand what their needs. So really approach bottom up instead of actually to come with your idea and then try to implement.
Yeah.
Because otherwise, I would not say fail 100%, but yeah.
Yeah, I think that that's a really important call out. And, whether it's global health or, really just change management in general, whether that's a large scale or a smaller scale, I think that true empathy and understanding of the problem, the resistance to change, what the context is really important to be able to start anywhere. So yeah, definitely a complex issue, but I think that, simplifying it down to starting with that is a great way to go about it. You also spent some time working in Uganda. What did you experience there that kind of further shifted your understanding of health as a systemic issue?
So Lao was the first, experience internationally, was the first approach that really made me understand about what is health and equity and equity. In Uganda, I went to volunteer. That was a different setting. It was not anymore hospital setting. I was within a refugees camps. So this is really, it make you even broader up, these systemic challenges or issue we could have. Because you could see there were no hospital there, okay? And in the refugees camp, usually you have volunteers that are even part of that camps either. So they're born and raised there. And then also the situation, because there is, understaffing, there is not enough money. Again, refugee setting, they usually deal within the country, but again, politically, there is a sort of nuances there. Who is the responsible for these people? Who is, responsible for their health? So during my time in Uganda, really, this has made me understand how the situation is more complex. There are many actors that they play within global health, which are not only government, but we have like implementing agency like United Nations providing food, shelter, humanitarian assistance. And you have the international NGO, the local NGO. So there is all as well like a lot of actors as stakeholders that they play a role in this kind of system.
Mm-hmm. Yeah, and how do you feel like your background as a nurse specifically affected the way that you like saw and approach these issues, especially when dealing with like those governments, NGOs, like policy teams? How does your background come into play, do you think?
I think my nursing skills and what is reflected in my work is actually the people-centered perspective. So we work firsthand with patients. We understand the day-to-day struggle. So we understand the challenges, the barriers, and the gaps they're facing in order to deal with their health. But it's not only that, like we really, work in the ecosystem. So we understand where are actually the struggle, the gaps, like how does it work? What do we need in order to implement? So when I try to implement a program, I always have in the back of my mind the experience that I have. I always try to think about, okay, if I was in that situation, working that of the hospitals, or in that particular health program, like what the people we actually needed, what they could help, the healthcare providers to deliver that initiative, that program, that activities, for instance.
Mm-hmm. Nurses lead with empathy, which I think is so important. I mean, as a nurse, you are just such a hub of everything in the healthcare system. You understand patient experience, you understand care delivery, you understand healthcare systems and how healthcare teams work together. So it really does give you this really broad understanding of like how everything can come together come time of like implementation of a new program. So I think that that's super important to call out. And that may be one thing, but like do you see other reasons that maybe like nurses are uniquely positioned to excel and like really make a difference in global health work?
With the skills that we have, like literally, like it we use in every day, like we coordinate within team, doctors, other care providers, but also like we're dealing like, between the patient and the family, the patient and the friends, like we're all like really, we are that kind of glue that bring everybody together. This is my view, that the nurse is like a sort of the center and we are sort of like managing. So definitely coordination, but as well like advocate for the patient. And especially in these things about global health, where it's not really all about health, it's about like justice, it's about dignity, it's about human rights. Because remember, the health is a human right. And sometimes, considering like lately the involvement of our world, I don't know if it's still the first priority. But anyway, so definitely like skills that we have to advocate for our patient, coordinate within the teams, and have this unique perspective that all like will bring the skills of nurse like to contribute to successful and effective and impactful international and global health programs.
Mm-hmm. And, sometimes I feel like, healthcare policy or global health can feel a little bit out of reach for a bedside nurse. It seems like this big thing happening way over here that's kind of hard to break into or dip a toe in. Do you have any advice for nurses who are like, yeah, like this sounds really interesting. I would love to, use my voice to help shape healthcare policy, or I'd really like to, I think I can make a difference in these like global health type issues. How can they start getting involved and start kind of turning their career down that path if that's something that really interests them?
It's a great question. And what I could advise to my fellow nurses is like start even small. I mean, you don't have to travel like me on the other side of the world to try to understand, but you could actually start to understand your like local reality. Okay. So your national system, or even like your hospital, how does it work? What are, the power, the gaps, the things that are play? So definitely, have an understanding of what is out there, or what's your interest first. And then like if you have the chance, like definitely read, study. I did a master in public global health, but also there are like available free courses on global health because again, as I was mentioning before, like there is like a range of actors play around global health. You were mentioning, Audrey, like this seems so far away, but actually just remember, like again, all these programs that I implement, you evaluate, they anyway go to healthcare providers that they have to do it actually. So there are other specialists as well, but especially nurses at the end, they're the one that actually deliver the care. And then also, like, if you have the chance, networking. So connect with like-minded people. Like, if you want to reach out to me, like, understand a bit more where I'm working, what I'm doing, please feel free. But definitely, like, understand your context, connect with like-minded people, and also try to get a bit more of understanding, like, what is global ed, what are different actors and our roles around.
Yeah, and I actually want to ask you a question to kind of go one layer deeper on kind of what a global health nurse role can look like. And so if you can kind of describe like your work day, your work week, like what kinds of things are you working on? Because, we talk about, well, we see this problem, we understand the context, we can implement this program, but like what does that actually look like when you are working in the role? Like, what could a nurse expect kind of like a day or a week as a global health professional to look like?
So first of all, like the transition, like is very different. Now I'm not anymore at bedside. I'm totally remote. I'm working at the desk office. So this is the big keep in mind, like that will less in-person interaction. Not always, like you can, go to event, conference and so on. But what I would say, like, is very diverse what you can do in global health. There is no like a one definition or one path that you will take. Okay. Global health is broader. Okay. When you understand, but then you can work on research. You can make policy. You can start to create a project or a program after a call of proposal from donors and funders. You can work as I'm working now in partnerships. So trying to be that kind of partnership that enable like to deliver a project or a program and impact like communities and individuals. So for me, my day-to-day now, I'm really like office job, Monday to Friday, and now, well, a bit as a consultancy as well. But basically, like, is a lot of like engagement with the local team that I have in the countries from, Middle East, Europe, Asia, South America, and etc., Africa. And there are different things that I would do. Like sometimes my work is compute like on communication part, where usually I develop report or communication, like highlighting the impact. Other time it would be like gather global health data in order to inform our program or project or to evaluate our program or project are doing. Or other time would be like engage with partners in order like to develop programs or projects that they can actually bring an impact like on different, it could be diseases, it could be even like innovation. Now AI is so, prominent and we're working a lot on that. So this is a very much, again, it's broader, is an overview. This is my role, but again, I don't think like my path, it could be similar to any others. You have just to try to see where you fit and what your, aspiration and what you like, what you give the energy, to carry on and to contribute.
Yeah, that's a great overview. And I think that, you called out, research, policy development, like programs, there is like a broad amount of options for nurses.
The opportunity as a career, what I want to say, like, is just, there's so much opportunity out there. So,
yeah, absolutely. And what do you think, like, is there anything that a bedside nurse listening might not realize about how valuable their insight or experience could be in global health work?
So for me, nurses really, they need to take the courage to realize that we have all these skills within us about communication, empathy, compassion, evidence-based as well. Like we're very evidence-based about our clinical, advocate for the patients. So definitely, this is like really a package, a full package of skills that needs in global health because my experience, I'm going to generalize now, but in global health, there are not many healthcare professionals that are working. And I would say that, but like, that's the reality. Whoever takes the decision, a lot of people there have other background, like international relationship, management, leadership. But actually, nurses have this understanding about health. And they will help you, like, really to deliver impactful and effective project or programs because you have this perspective. So I would say to my fellow nurses, please don't be afraid, like, really to try explore and also put your expertise and experience on the table and make sure to be there in that conversation.
I think that's great advice. And it comes up a lot on this podcast that nurses kind of, we take for granted some of the really important and valuable, like transferable skills that we have because when we're working at the bedside, they're just things and traits and qualities that get us through our day, right? Like we can work in a fast pace, we can prioritize really well, we're really like organized, good project managers, we can work well with teams, we can communicate complex things. Like all of these things, we just are like, well, it just is how I do my job, right? Like it gets me from clocking in to when I clock out. It allows me to do everything I do throughout the day. And we kind of overlook that these are really powerful skills that can be leveraged into all kinds of things. So I'm really glad that you called that out here too, because I think that nurses really do need to start paying attention to like, what are those underlying skills that allow you to get through your shift? Like what is underlying all of the tasks of your day? What helps you get there? Because those are going to be the really powerful transferable skills that you need to learn how to speak about and kind of market yourself to kind of pivot into a new thing, because the skills are still going to be applicable in a totally new setting. And, how else do you think like nurses can begin to like build that experience or knowledge that positions them to make an impact on a larger scale? I know that you mentioned taking a look at like what's going on in your own community and getting involved there. How can nurses think about those tactical steps of, okay, I'm volunteering in my community, I know what's happening here. How can they start, taking that beyond their local community and understanding what's happening globally? Are there organizations, conferences? Like how can nurses start to get involved and learn more about that?
As I did for myself, like really, I started to Google it, try to looking for, organization, inform myself what this kind of organization, they could be no profit or other like local entities that you have in your community. Start to engage with them. Go for a coffee, for a chat, for a lunch, for a dinner, share, experience and listening. Try to see if, you could fit there. And if you have like an idea, don't be afraid to share it because, they could be actually a very good idea. Someone could actually listening. So that other things that I did there, it was, a conference or health conference, like of topic that I enjoy or was interesting to. And I was going there, speak to people, try to make myself visible as well in a way and try to understand as well, like what is out there. Because again, we are bound anyway to our job market. So we need to really try to see the fit. But yeah, that would be like the baby step that someone can take initially.
Yeah. And I'm glad that you're bringing up networking too, because I think that is really important. You mentioned making yourself visible and, not being shy with your ideas. And I think that that's really good takeaway advice because, all too often I feel like working at the bedside, you kind of become quiet with your ideas. If you share ideas and nothing happens repeatedly, then you become less apt to share them in the future. But I think that what you're calling out about share those ideas, it could be really good. You just need the right listening ear and, putting yourself into these new networks and new conversations could be just the lever you need.
Yeah. And keep trying because for me, again, my path wasn't straight. It was full of, hiccups, upside downs and keep trying and try frustration, apply for different jobs. But again, if you follow, your desire and your passion, you will get there eventually.
If you'd like to connect with Mara after today's show, you can find her LinkedIn in the show notes below. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, sign up for my free newsletter at mypivotpath.com. Get non-bedside jobs delivered to your inbox every week. And if you have questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and until next time.